So whatever my mind can see, that I will achieve, because I do the things I should, between my brethren kind and good. So I'll keep moving on, I won't stop now. I'll keep moving on till I reach the top somehow.
Okay, my Straight Talk family, it's 3 minutes past the 8 o'clock hour, and time for me to welcome you to another edition of Straight Talk. And it's okay to remind you that Straight Talk is a public service program that facilitates and promotes free expression on all issues of national interest, be they legal, be they environmental, be they technological, social, economic, and or political issues. On Straight Talk, you do have a forum to express yourselves freely. Let us, in the process, continue to keep St. Kitts and Nevis as one of the freest countries in the entire world. On this program, we try also to raise the level of national consciousness. We try to raise the level of national discourse by alerting our people to their rights, to their responsibilities, and certainly to their obligations. My name is Ian Patches Liburd, and I give Almighty God thanks for blessing me with yet another opportunity to join you in conversation on yet another occasion. And for those first-timers, again I'll repeat, Straight Talk is a public service program that facilitates all issues of national interest. And it is also what I call a participative program. And by that I mean we include your calls, we include your emails. And if you're so minded to call, the numbers are 718-577-2916. And if you like what I call the cloak of anonymity, you hide behind your keyboard, give you access via our email platform, which is zizstrighttalk@gmail.com. All we ask you to respect others, and of course, you must respect yourselves. And for tonight, we have a special guest. We have a special guest tonight in our studio. He is already in our studio, and that special guest is Dr. Cameron Wilkinson. My guest tonight, Dr. Cameron Wilkinson, who for a long time, I thought he was born in Newtown. But in more recent times, I found out that he was actually born in Basseterre. Suffice to say, nonetheless, Newtown is in uptown Basseterre in St. Kitts. I'll leave it there. If he wants to add, and he gets the opportunity, he may do so. But they may not recall that way back in 1982, Dr. Wilkinson obtained the best A-level results in St. Kitts and Nevis, thus winning the state scholarship before going on to study medicine at the University of the West Indies in Mona, Jamaica. After graduating with a Bachelor of Medicine and Bachelor of Surgery degree in 1989, he moved on to the Queen Elizabeth Hospital in Barbados, where he won prizes for the most outstanding student in surgery and in medicine and therapeutics. Dr. Wilkerson was then accepted into the general surgery residency program, I should say, at Harlem Hospital right here in New York City, where he completed a 5-year surgical residency program in 1995, winning the Program Director's Prize for the most outstanding chief resident. Dr. Wilkerson obtained many more accolades for outstanding service to the greater Harlem community in New York, and had much more academic achievements before returning home to St. Kitts to work in 1997. Dr. Wilkerson has therefore been a practicing physician and surgeon in St. Kitts for nigh 25 years. And for that period, correct me if I am wrong, Dr. Wilkerson has been, or rather still is, the chief surgeon and medical chief of staff at the Joseph in France General Hospital for the past, I must say, almost 25 years. So you see, the man going so cool daily, his background is not touted for much time, or not touted at all. And I have to do that tonight. Even in September 2020, Dr. Wilkerson was also among 14 other citizens who were recognized for their sterling contribution to nation building during a ceremony held at the National Heroes Park in observance of National Heroes Day on Wednesday, September 16, and he was the recipient of the Companion of the Star of Merit for National Service in a Crisis. I can go on and on. I can perhaps take half of the program to tell you about this, or the achievements of Dr. Wilkerson. But he's a humble guy. And I'm so humble as well to be in the company of this distinguished son of the soil. And I welcome Dr. Cameron Wilkerson to Straight Talk one more time. Before I invite Dr. Wilkerson to make his introductory remarks, permit me to establish one protocol for tonight, at least, to it. And I do so respectfully, because a man's name, it is said, is the sweetest language in the entire universe. So I want to establish, can I call you Cameron?
As a matter of fact, you can also claim me to be from Newtown also. My father was born in Newtown.
Your father was born in Newtown?
Yes, Woody. You know Woody,
okay.
Man.
Okay, yes. Well, I wanted you to say that yourself. And Woody was one of the famous joiners.
Yes.
So, once I can call you Cameron, having established that, then you can call me Patches. Welcome, Cameron, to another edition of Straight Talk. And an internationally acclaimed author, Terry Pratchett, once opined that it is important that we know where we come from, because if you do not know where you come from, then you do not know where you are. And if you don't know where you are, you don't know where you are going. And if you don't know where you're going, you're probably going the wrong way. In that context, I therefore invite your introductory remarks and tell us, what is the exact disposition in the fight against COVID-19 in St. Kitts and Nevis, Cameron?
Okay.
So while you get yourself sorted out, I'm sorry about that, but you can proceed. Yes, so as I was saying, Cameron Wilkerson will be here with us for the entire program. Straight Talk is a participative program. As I said, we would include your calls, we would include your emails, and now you have eared up, then you can proceed and tell us where we are and where we came from, Cameron.
I just want to start with some opening remarks. I want to say that we have been in this fight against COVID-19, in this pandemic, for going on 2 years now. But in addition to fighting the coronavirus pandemic, we have had to fight a pandemic of hypocrisy. And what is hypocrisy? It is when we are inconsistent in our morality, commonly referred to as saying one thing and doing another. Some of us wear a mask and it's uncomfortable, but we tolerate it because there's a pandemic and we all have to do our part to keep everyone safe. Except that one person who puts on a scene yelling about their rights to go unmasked, to be unable to breathe, to be free to do as they please. Everyone else can wear a mask if they choose, but not you. We also go out and get vaccinated to protect ourselves and those around us because the vaccine significantly reduces our risk of catching and spreading the most deadly virus that has so far killed over 5.51 million persons in just under 2 years. Everyone else can choose to get vaccinated, but not you, yet you want to move about normally as if the pandemic is over and put other people's lives at risk because of your choice not to get vaccinated. But in refusing to wear a mask in public, and by refusing to be vaccinated, but wanting to freely mingle with others and put them at risk of getting infected, getting severely ill, and dying, you are denying other people the right to live in security. If most of us shared that view, we would not have had 81.8% of adults in the Federation as of today covered with one shot and 76.2% of adults fully vaccinated as today's tile shows. It's because others did what was required of them in this fight while we are beginning to reopen the economy to the benefit of all, and while we are buffering the ill effects of the fourth wave caused by Omicron. If we believe in a principle but don't apply it to ourselves, that principle essentially is meaningless. On the road to this 76.2% threshold of adult population immunity, we had to fight a lot of misinformation and misleading information spread by some who did not use that same misinformation for themselves and theirs. Making a decision to get vaccinated is based on correct scientific information, and if the information given is not clear and accurate, the wrong decision can be made by those depending on you for credible information. If you know that the vaccines are safe and effective, but give people the wrong information or an unclear message, this is misleading and continues to make our job in this fight more difficult. You cannot tell someone to wait for an alternative vaccine when you and your loved ones were the first in line to get the AstraZeneca or the Pfizer vaccine. You cannot tell someone not to get the extra protection offered by the booster when you and yours are lining up for the booster. This is dangerous and hypocritical. We have a right to choose, but we cannot continue to ignore the responsibility that comes with every right. You want the right to live? Then you have a responsibility to the rights of others to live. You cannot endanger the lives of others with your decision. You want to use a public space, then you have a responsibility to share that space with others without endangering their life. To believe you have a right without a corresponding responsibility is dangerous and hypocritical. Public goods are shared spaces and qualities we all benefit from: education, clean air and water, health and the environment. Without the public good of health, our quality of life drops dramatically. We get sick, the economy shuts down, we lose loved ones to diseases. We should all benefit from good public health, and equally so should all be willing to help to maintain it. The virus is relentless in its attack, and we must be relentless in our fight to protect ourselves. You may say that you have a right not to wear a mask in public and a right or choice not to get vaccinated, and that right may exist. However, if you think public health is a good thing, but you aren't willing to take a basic measure of responsibility for it, like wearing a mask in public or getting vaccinated, it can make the disaster or the pandemic worse for everyone. We also cannot continue to ignore scientific evidence, the truth, and facts. The vaccines are safe and effective. They offer significant protection against severe disease, hospitalization, and death. They significantly reduce your risk of catching and spreading this deadly virus. Let's work together to end the COVID-19 pandemic and also the pandemic of hypocrisy. The non-pharmaceuticals are important, but vaccination is key. Go out and get the best protection from this deadly virus and its variants by getting your first shot or your second shot. Go out and get the extra protection by getting your booster, so we all can enjoy shared spaces without putting others at risk and safely open up the country and the economy. With those few words, Ian, I turn it over to you, and I'm willing to answer any questions you may pose.
Thank you very much, Cameron. Always straight to the point and quite assertive. But to get our discussion into perspective, to be specific, on March 11, 2020, the World Health Organization Director, or the Director General, I should say, Dr. Tedros Adhanom Ghebreyesus, made this pronouncement to the world. He said this:
in the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. Thousands more are fighting for their lives in hospitals. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
And that was like 2 years ago. Cameron,
Yes.
since we've been battling this coronavirus-induced pandemic, and when we reflect, though, Do you think, or did you ever fathom the thought back then we would still be talking about the pandemic today in 2022?
Well, Ian, the virus is a microscopic organism. It has no legs, it has no wings. It cannot move on its own. It depends on human beings to travel. And so if we don't move, the virus does not move. And so very early on in the fight, there were border closures, lockdowns, curfews. Persons were asked to stay in place. They were asked to use a mask to prevent the transmission of the virus in respiratory droplets. They were asked to sanitize their hands and surfaces so that if the virus escaped, it could be killed. And I believe if persons followed the prescription of non-pharmaceuticals very early, we would have been able to contain this virus. We, however, need to look at history, because the pandemic before this was the Spanish flu that ran from February 1918 to April 1920. That's a total of 2 years. And in that time, it infected about 500 million people, which was about 1/3 of the world's population. And by the time it had run its course, it had killed over 50 million persons. However, back then, there were no vaccines. Back then, there was not the ease of travel, because the first transcontinental flight was in 1923. And so for the virus to have left, for example, China to reach to the United States or the Caribbean, it would have taken months. Now today, with the ease of travel, that virus can get on a plane and be across the Atlantic in a few hours. And so knowing that there was ease of travel, and also knowing that human beings in general, they were not taking the virus as serious as they should, I was not surprised then that 2 years later we are still talking about COVID-19. To date, we have over 308 million persons who have been infected, and we have recorded over 5.5 million deaths. And yet there are some persons who are not taking this virus seriously. We, however, have to know that no one is safe unless everyone is safe. And so COVID-19 is not like you have two people in a room who have hypertension and one chooses to take their medication and the other doesn't. And the ill effects of hypertension will only affect the one who does not take their medication. The singular action of a person can affect every single one of us. And if we don't wake up and realize that we are the ones with the brain and not the virus, if we don't take this thing seriously and use the non-pharmaceuticals all the time that are prescribed to control this virus, if we don't go out and get vaccinated to give ourselves the best protection, we will continue to see variants developing, and we will go through every single letter of the Greek alphabet with variants until this virus runs its course. We are the ones who are responsible. We can control this pandemic, and I am hoping that after we get through Omicron, we can get to the end of this. So let's hope that next year I'm not back on your show talking about the same thing.
But you use two words, I call them operative words. You said control the pandemic, but you also speak to ending the pandemic. But and you mentioned the Spanish flu as well, which lasted for 2 years, from 1918 to 1920. We haven't reached the level of deaths thus far. Hopefully we will not. The great Dr. Fauci, like him or not, and some like him and many don't, but he had this to say in terms of the eradication of the pandemic.
We're not going to eradicate this. We've only done that with smallpox. We're not going to eliminate that. That only happens with massive vaccination programs like we did with measles and with vaccines, but we ultimately will control it. And if you control it in a way, it's at such a low level, and people are vaccinated and boosted, sooner or later, as we begin to live with it, what she was referring to is that virtually everybody is going to wind up getting exposed and likely get infected. But if you're vaccinated and if you're boosted, the chances of you getting sick are very, very low.
So it seemed to suggest, or what I'm hearing, that you would not eradicate it, but you'll have to control it.
Yes, well, we're on the same page with that.
Is that what you are saying as well?
That's exactly what I'm saying. I said, number one, we have to control it, and we can end the pandemic. The virus, we are hoping that it can become more and more weakened with the variants. It will eventually become endemic. I am hoping that Omicron is the one that will be the endemic virus, since it is proven to be less severe than all of the other variants. However, it is highly infectious, and so there will come a point in time when everyone will have some degree of immunity, either through vaccination or through repeated infections for those who choose not to get vaccinated, such that it will peter out into a disease that is not a significant threat to our health, and we can continue to live with it without any deleterious effects. And so I don't foresee the virus disappearing, but I am hoping that we can have a variant that is so less severe that we can all be immune and live with it.
Now, Cameron, you mentioned this fourth wave, right? And as a small nation, so one of the smallest nations, if not the smallest, independent nation in the Western Hemisphere, with limited resources, the Federation of St. Kitts and Nevis, I believe it's fair to say, has done reasonably well. But as you intimated earlier, we are currently going through our fourth wave of this COVID. And unfortunately, we have recorded 28 deaths. I say 28 deaths too many. But what have you or will you attribute to our success thus far in fighting this virus, this coronavirus, this pandemic?
Well, first of all, Patches, I wish that we had 0 deaths. Some of the deaths that we had, they were avoidable, but my sympathy goes out to all of the families who have lost loved ones, and let's hope that that number doesn't rise any further. However, the secret, I think, to our success was that we kept science at the core of every decision that we made, and we stayed focused and did not get distracted. You would have heard me more than a year ago speak about our simple 4-prong approach to the management of COVID-19 with the assessment of the progress that we made at each stage. And I will recap what this 4-prong approach was. 1, it was to keep the virus at bay as long as possible with very stringent screening protocols at our ports of entry. And we were successful at this, being one of the last places on the face of the globe to have its first imported case on the 24th of March 2020. Second was that once the virus arrived, our aim was to limit hospitalization and deaths. And we were again successful at achieving this, as we were one of the few nations to have had 0 deaths and no major hospitalizations as a result of COVID-19 disease for 16 months into the pandemic, until we had our until we entered the second wave in May, on May the 19th. As a matter of fact, our success at managing this pandemic then caused us to be recognized internationally as the country with the lowest rate of confirmed cases and having the lowest COVID-19 risk in this part of the hemisphere. The third leg or prong was to limit the time between the development of community spread and the arrival of a vaccine, while at the same time keeping everyone safe with the prescription of non-pharmaceuticals. And we were again successful in achieving this, having started our vaccine rollout on February 22nd last year, while we were while we were still COVID-free. And during this time, we actually had a golden opportunity to get as many persons vaccinated before we went into community spread. Unfortunately, everyone did not heed the call. And the fourth and final leg of our approach is to vaccinate a significant proportion of the population to get us to an immunity threshold so that we could effectively fight off the continued relentless attack of this virus, so that we can open up our economy. Now, without a vaccine mandate, I believe that we have been very successful with our adult vaccination program. And one may ask, well, why were we successful also? I believe we were successful because our people had confidence in the message that we were delivering through our education program about the vaccine's safety and efficacy. And many of our Caribbean colleagues have called us to ask us, what was the reason for our success, because some of them have had mandates to get to levels even below which we got to with voluntary vaccination. And it was because our education program was comprehensive. We went into almost every single school. We went into every single community center with the message across the Federation of St. Kitts and Nevis, so that persons could be educated. I also believe it was because our people had confidence in the health services offering the vaccines, and that is why they turned out in large numbers to our health centers across St. Kitts and Nevis to be vaccinated. We opened our clinics 7 days a week so that we made it convenient for everyone to come forward to be vaccinated. We even went into some of the workplaces to make it convenient so that persons can be vaccinated. And I also want to say that we were successful because our people had confidence in the policymakers deciding on the rollout of the vaccination program, starting from our dear Prime Minister, the Minister of Health, the Permanent Secretary, and the Chief Medical Officer, and every member of the health team in St. Kitts and Nevis. And lastly, because we were persistent, I'm pretty certain that you've seen my face all over the place for the last 2 years, preaching the message, being relentless in the attack against this virus. And I want to ask everyone to come on board so that we can see the success that we want, because everyone will benefit from this. I am making sure that when we get through this pandemic, I can lie down and say that I did every single thing that I could have done to keep this country safe. That is why one of my weakest points is singing, but yet I even went and sang a calypso with the CMO. I think she's the only person I can sing better than. You can support me on that. But we both put our talents together to help to promote the message about getting vaccinated.
Yes, you sing very well, and you write as well. Lyricist, my brother. But you mentioned the policymakers, and you mentioned the focus on the science. And I want you to debunk, if you can, and I'm sure you can, and you have an opportunity to do so, because those opposite would have said that they were not included, and some would say there was political interference in terms of some decisions. Is that true or false?
Well, I mean, from where I said that is completely false. From very early, we called for an all of society approach in this fight. When we set up the briefings, from which I was a part of, we made sure that it was apolitical, and that is why only as a guest you would have seen any politicians coming to the briefings. And that's why very early you saw the persons who we had there was the average person. We had the fisherman, the farmer, the baker, persons coming forward in this fight. If you were to look back at the tapes, you would see so many persons who came forward and they made donations, etc. We approached all of society to engage them in this fight. The Medical Association, the Bar Association, the Nurses Association, the clergy. If you think of any NGO, we approached every single one of them and invited them to the fight with us. We approached all of the business places and asked them to come on board in this fight. We had a meeting with all of the political parties across St. Kitts and Nevis and engaged them and asked them to support us in this fight. And so if anyone says that, they are probably misinformed.
Now, Cameron, thanks for clarifying that. What have been the greatest challenges in this fight, though?
Well, when I look back, and in my opening remarks, I spoke about the pandemic of hypocrisy. And I believe the greatest challenge really has been fighting the misinformation. And why I say that has been the greatest challenge, because I have seen persons one-on-one sitting in my office, and some of them really and truly believe some of the misinformation that they were being given. And when they assume that they're getting it from a credible source, they would base their decisions on that. From way up in North America come down, we see that this virus has been politicized. The vaccine has been politicized. And I believe that we should have used the opportunity to unite as a people to fight this virus, as opposed to letting the virus separate us. If we look at where we are with our vaccination program now compared to when we started, in the Federation of, in St. Kitts, we have over 86% of adults who have come forward with one shot. And so what this is telling me, though, is that despite the fact that we had a significant fight against the misinformation and the disinformation, that people are waking up. I can tell you, you mentioned in your opening remarks about the fact that you thought that I was from Newtown, and I consider myself a Newtown man. I consider myself a village man, and I consider myself from Central Bast. I was born in Nevis Street, and you would know when you're growing up you had to be tough, because we went through a lot of heckling and things like that. You know, people were given nicknames and you had to toughen up. And so there are some persons too, when they could not attack the message, they attempted to attack the messenger, myself, Dr. Laws, etc. But I want to tell persons that those things do not bother me at all, because having ran the gauntlet of Newtown and Nevis Street and Market Street and the village, I don't worry about those things at all. My focus is on the safety and security of the people of the Federation of St. Kitts and Nevis, and I will continue my fight until we get everyone who should be vaccinated, and we get through this pandemic safely without any more deaths, hopefully.
You mentioned the pandemic of hypocrisy, and you mentioned the numbers that have been vaccinated, and at least the first dose, 86%?
86% in
population is in kids,
yes,
I think
yes,
you said.
yes.
But President Biden, as late as today, spoke of the pandemic of the unvaccinated in a similar context. He said this, context I should say, he said this.
We have in hand all the vaccines we need to get every American fully vaccinated, including the booster shot. So there's no excuse for anyone being unvaccinated. This continues to be a pandemic of the unvaccinated. I know.
So, can you say that we have on hand, in the St. Kitts Nevis context, all the vaccines that is necessary to get the targeted population vaccinated, and in addition, getting their booster shots? Can you say that?
Well, I would not say on hand, but don't forget we get the vaccines in tranches because we can't afford for the vaccines to expire on us. But we will have available all the vaccines so that we can vaccinate every single one who needs to be vaccinated. Yes. Okay.
How do we have that high vaccination coverage, as you just intimated, and you just really provided the statistics? High vaccination coverage amongst our adults, but still a low vaccination rate among our children. So how do you envisage, how do you think we can get these numbers up?
Well, you know, when you are on an aeroplane and it starts to hit some turbulence, if the cabin pressure drops, the captain will tell you, put your mask on first, and then you take care of your children. The adults in the Federation of St. Kitts and Nevis, they have spoken, they have come out in their numbers, and they have gotten vaccinated such that we have a threshold of immunity among our adults of over 80% with one shot, and over 76% who are fully vaccinated. And I fully believe that these same adults who are responsible for the children, that they will now, after they have put on their oxygen mask, they will turn and put on the oxygen mask on their children to make sure that their children are safe. Because I don't believe any mother, any father will give themselves the best protection against COVID-19, which is the vaccine, and choose not to offer that protection to their children. And so we see the numbers climbing slowly. As of this afternoon, we had 14.8% of our children between the ages of 12 to 17 who were fully vaccinated, and 17.2% with at least one shot. And just as it occurred with the adult vaccination program, once we reach certain thresholds, then people start to come forward. And so I am waiting to see when we hit the 20% threshold for the children, and then you would see the numbers start to increase. But we need to be persistent. We need to continue with the engagement. Because we need to keep our schools open. We cannot continue to have children staying at home with remote learning. Ian, I will tell you, if you went to school and you had to stay home for a year and sit behind a screen to do your maths and your chemistry and your physics, you will not be where you are today. And we cannot have that happen to this generation of our children, otherwise we will lose them. It might work for one or two. There are some children who will do well in spite of the teachers, but there are some children who need that in-class learning so that they can do well. And the only way we can keep our schools open if we make the schools a safe place for our children. And the only way we can make the schools a safe place is if we give the children and the teachers the best protection against COVID-19, which is the vaccine. And so I am hopeful, I am optimistic, I am certain that the figures among our children, the 12 to 17-year-olds, it will rise such that we would have a significant level of immunity among these persons, because very soon we should be having access to the vaccine for our 5 to 12-year-olds also. And so I would like us to get that section of the population vaccinated and then focus on the younger children once that vaccine is available.
What are the variants that we have experienced in St. Kitts and Nevis?
Yeah, well, the variants we have documented circulating in the community, first was the Lambda variant, followed by the Omicron variant. Yesterday I was asked about whether or not the Delta variant was in circulation. We had no evidence of that, both from the clinical picture and also from documentation through testing. During the time when we had the extended quarantine period, we had a total of I think 2 persons who came in and tested positive for Delta while in quarantine and recovered. And so the Delta variant never got into the community. And so during the previous 3 waves, we did not see evidence of the Delta variant being out there, where countries who had experienced the Delta variant had increase in hospitalization, deaths, etc. We knew even before we had the documented evidence from the genomic sequencing that we were possibly dealing with Omicron, from the way the cases were starting to spike significantly. Okay, and that was confirmed with the sequencing testing that was done. On January 5th, we sent off another 25 samples to be sequenced, and as soon as we get that information, we will let you know.
Now, Cameron, and in the event you have just joined us, Straight Up Family, I have with me in studio Dr. Cameron Wilkinson, who is the medical chief of staff and chief surgeon at the Joseph N. France Hospital. A son of the soil who has come back home to do his service, and he has been with us for the last 25 years, just about that, in public service. I heard him say at one time, I'll say this for him, he's straddled different governments, obviously, so he is not into the other ticks except his medics. Now, we're going to open the lines in a moment, because Straight Talk, as I said, is a participated program, and we'd like to hear from you. And just before we open the lines, it was the end of last year when the state of emergency was lifted. Yes, you do have these COVID-19 regulations or legislation that guides the process as we speak. But this 4th wave has been a challenge for many countries, inclusive of St. Kitts and Nevis. But their discussion about the carnival, CPL, and other activities. But could you say, or would you say, that St. Kitts and Nevis could have avoided a 4th wave? And how are we doing now? We are going through, or we are experiencing that particular 4th wave. So it's a two-part. Could we have avoided it? And how are we doing in terms of our response?
That's a very good question, Ian. Now, back in December, when we came out of the third wave, and I think that our positives had dropped down to about 6 after we had about 1,000 before, and people were beginning to relax and were feeling happy, I said that a fourth wave was inevitable. It was inevitable because once we are moving forward with living with COVID and having our borders open, the virus was going to return, and so it was inevitable. I, however, said that we were not helpless and we could have made the fourth wave less severe and less deadly if the majority of our persons came forward and got vaccinated. I was therefore not surprised when by the 24th of December our cases started to rise, signaling the start of the fourth wave. And so there is no reason to look back and blame it on CPL or Bubble Juve or Chatterbox or any event. It was inevitable. It was bound to happen because a negative PCR test is as good as the time when it is taken. You can test negative now, but as you walk out the lab, you pick up the virus. And so although we have a requirement for persons to have a negative PCR test within 72 hours of coming into the Federation of St. Kitts and Nevis, that gives us a level of protection, but it is not foolproof. And so Omicron did not start in any carnival event. Omicron came through our port. It either came by air or by sea, and this was inevitable. We, however, know how to protect ourselves through vaccination, and I believe that it is our high vaccination threshold among our adult population that is giving us the protection. Omicron is proven to be less severe to the individual. However, if we have a massive outbreak, it can put a significant stress and strain on our healthcare system. Omicron is highly transmissible, and therefore it can infect both the vaccinated and the unvaccinated. However, if you're vaccinated, your symptoms are very mild, if not asymptomatic, and your recovery is much quicker. Now, this virus will come to the doorsteps of every single one of us, and so we have the decision to make whether or not we will be protected when it knocks on our doors. And my advice to the general public is they need to make sure that they cloak themselves in the best protection if they are eligible for a vaccination to get vaccinated. I am very happy today, however, that for the first time since this outbreak, we recorded 85 new cases, but we recorded 130 recoveries. And so this is the first time since this wave that our recoveries have outnumbered the number of new cases. And so far in this fourth wave, we have had 608 recoveries, with, as I said, a record 130 recoveries today. We still have 1,269 active cases. I'm happy that we are still at 28 deaths, but we can control this thing. As I said, there is the government, the Ministry of Health, the doctors, is only so much that they can do, but personal responsibility is at the heart of this fight. And if people wear a mask, if they try to social distance as much as possible, if they come forward and get vaccinated, we can get through this fourth wave safely. And I'm hoping that within another week or two, we will be out of this wave and be able to continue to enjoy the joys of having an open economy.
I'm going to go to the lines, Cameron, in a few seconds. But I'm forced to ask you this question. The last 2 years, how have you slept at night?
I sleep on my back. Actually,
Whatever that,
yeah,
whatever that means.
I actually sleep very well. You know, to be quite honest, Ian, I'm a hard worker. I enjoy hard work, and I enjoy what I do. And I believe when you enjoy what you do and you put your heart and soul in it, it does not feel like work. And so that is why, for example, when you called me about coming on this show, I told you yes. That is why I was in almost every single community center when we were having the education program, because when I'm asked to go and speak, I say yes. That is why I spoke to almost every single PTA, whether it was the primary school or the secondary schools, to help to educate the teachers and the parents about the vaccine. And I just continue to do my part as a citizen, and what I want is for other persons to do the same thing, because what I'm doing is voluntary work. There are some persons who think that I am being paid for all of this. This is not so at all. This is a labor of love. I can do like some persons and sit in the back and just criticize or just hold my corner and just do my surgical work, but I cannot sit by and see my country in crisis and not step forward.
But it must have been nerve-wracking, knowing our hospitals, or the capacity of our hospitals. And when these cases, when you had this spike, this surge, it must have been nerve-wracking though.
I guess you want me to say yes. I'm not someone who worries, Ian. I always see the glass, half full. I don't worry, and if I'm falling, I would not worry until I hit the ground, and so I'm not someone who worries at all. That's not part of me.
Well said, Dr. Cameron Wilkinson. If you have just joined us, is with us for the entire program. We welcome him back to Straight Talk. It's the second time I believe he has been on Straight Talk. He's been doing, to use his words, a labor of love for the last 2 years thereabout in this period of crisis. And I'm going to open the lines and entertain your calls and or your emails. The numbers are 465-2555 if you're calling locally. Oh, that number is accessible to all. If you're overseas, then you need that area code 869. There's a US number for those in particular in the diaspora, which is 718-577-2916. Our email address again is ZIZSTRAIGHTALK. That's ZIZ Straight Talk at gmail.com. I always find it imperative to implore you, nonetheless, to respect others. And of course, to achieve that, you must first respect yourselves. Let us try to be fair to all concerned. Let us try to build goodwill and better friendships. Let us, as we say and do these things, ensure that they are beneficial to all concerned. And in the process of doing and saying these things, let us strive to build a kinder, gentler St. Kitts and Nevis. The lines are open. We will entertain your calls, and we will now go to the lines at 1 minute past 9 o'clock and say, caller, you are live.
Good night, Doc. How are you? Good night, Doc. How are you?
Good night. I'm fine.
Here's a greeting to you. I'm so glad you can come on Straight Talk. Even the misleaders are abusing and saying you all don't know what you all doing. We hear the amount of debt in the outer world. So thanks again for a job well done so far. You and Dr. Laws and the rest of the task force who have it under control for just 28. They're still abusing, all because they don't want to follow the rules. Thanks again. Stay strong.
Thank you. Thank you.
Thank you very much. Sounds like Alice in Wonderland. At 9 o'clock, we go back to the lines. Call you live.
Good night.
Good night.
And good night to my loving doctor. Patrick, this is Dumpling. And Dr. Wilkerson?
Yes, Dumpling, how are you?
Hi, my dear.
This is Dumpling.
Yes, hi, my dear. Good night.
You come up a poor man from Nevis Street. I mostly know you in Marshall Alley. And then we went to the village.
Yes,
And
yes.
I do not know why the petition trying to bring you down so much. And you leave from in the States, come home, try to help poor people, and they want to bring you down with this virus, saying the house, you're telling lies. How you going to be telling lies? You're not telling any lies. You operate on them, you go when the foot them badly off, it's supposed to come off, the views about that. They want to ridicule you. Everything you do to help repetition, the views do. I do not know why you never go up Nevis. You would be more loving. This is needed. But anyhow, Patrick asked you how you sleep. You say you sleep on your back. God put you on your back with his prayers, especially with Jazzy D, Agiato, and the gentleman. God have you, dear. My doctor, I love you. And you know I love you. God bless you. See you.
Thank you. Dumpling, we go back to the lines. Call you live.
Good night, Patrick. Good night.
Good night, Politics.
And good night, Dr. Wilkinson.
Hi, good night, my friend.
A blessed new year to you, brother.
Same to you, same to you.
Yeah. I want to commend you and the CMO and the task force. I believe you all have taken the fight to COVID in the Federation. And I believe that you and Dr. Lars is a star. He's a star for COVID. I believe when the COVID over, worldwide, I believe that you and Dr. Lars will be the star to manage the COVID in the Federation of St. Nevis. And I believe that you are under some kind of plug for that. Because it ain't easy. You are trying to fight this deadly COVID in the Federation and criticized by the social media, criticized on some radio station, they call it panic factory, criticized by people on the road, people ignorant towards the vaccine and everything. But we know that God got you all there for purpose. And we know that you all is doing a good job. Especially the 98% literate are the people in the Federation. You know you all is doing a good job. That's why they find out and they're taking the vaccine. So you will also in those and the next side will criticize because that is what politics is all about. But I do not believe that we're supposed to put politics with this COVID situation. We're supposed to move about that because COVID ain't picking out nobody who to contact with it, or who to kill, or who to do whatever they want to do with them. And I just want to commend you again and the task force and Dr. Wilkinson as a son of the soil. We in this federation believe that you're doing a wonderful job, and we will be only 100% you and Dr. Lars and the task force. You have a wonderful night. Like, another person to after this over, so you forget. Now that if you take the 2 shots, right, at the AstraZeneca, or the 2 shots at the Pfizer, and you don't feel no other effect and you don't take them in a feel good. You must take a booster shot.
Yes, if you've gotten your 2 doses, the scientific evidence has shown that if you get a booster with the Pfizer, you get extra protection. It doesn't matter if you feel well or not. Getting the booster will give you extra protection, especially with the new variant Omicron around. It gives you extra protection. So if you have had 2 shots of the AstraZeneca or 2 shots of the Pfizer and 6 months has passed, I would suggest that you go and get your booster.
Okay, I don't take the shot of the AstraZeneca. Well, it could be any, it could be already, I could get the Pfizer.
Yes, it is advisable that you yes, because that's exactly what I did. I got the first 2 shots of AstraZeneca and I got my Pfizer booster. Okay, so you can go out and get that.
Because right now you see me speaking, I got the itchy throat, I got the coughing, and you know, I believe that this vaccine is working for the people. And I want to encourage people not to be ignorant, to continue to listen to you and the CMO, because you are the expert out here, you are the study medicine. And those who are ignorant to the fact and what other people want to follow them, and he go blindly and go to me and get affected by COVID and whatever to them is their fault. Anyway, I want to wish you all the best. You and the task force. Continue to fight, brother.
Thank you.
Thank you very much. We go straight back to the lines. Call your line.
Good night, Mr. Wilkerson.
Good night.
Good night, Doc. I don't know you first time. I always listen to you and I always take what you say. Because I have my granddaughter pass in England. I don't know if she did take it. Virgil February. And if she were here, I know you should have get help. And thank God for you and Simo and Dr. Laws. Love you. I was upstation. I don't know you. I got to know you, Doc. It's very nice and you're taking care of, I think it's Nevis. God bless you in the Federation.
God bless you too.
Yeah, and one my family in station, they just come out of quarantine because this thing is not easy. Yeah, they had they had it, but they get over it.
Okay, that's good.
Be safe.
Thank you.
And the family. Love you, Doctor.
Okay, thanks. Bye.
Yes, we love you. Before we take the call, is there any comments you want to make in the meanwhile, Doctor or Cameron?
Yes. For example, one of the callers spoke about having a little itchy throat, etc. And we have evidence that the vaccines are working in that most persons who are vaccinated, they have very mild, if any, symptoms at all. And this Omicron variant is going to find all of us eventually, but we need to make sure that we are protected. And I'm happy again, though, that although you hear all this argument about vax and unvax, people are coming forward. The people are listening. The people of our federation, as I said before, we have 86.4% of our adults so far with 1 shot. That is significant, Ian. That is significant. Very soon we'll be in the 90s.
Thank you for holding, caller.
Hi,
you are live on Straight Talk.
I don't know if this question was asked before, but I'm asking for a friend. How soon after you get you recovered from COVID, can you take the second shot?
Okay, as soon as you're deemed recovered, you can go and get your shot. So, because persons have to understand that if you get infected, especially if you're not vaccinated, you can get infected again. I can tell you that looking at the data, I'm seeing persons who were infected before, who were not vaccinated, who are coming down with COVID again. And if you come down with COVID a second time, you can have more severe disease. And so persons would have celebrated when they got over COVID the first time. If you don't go and get the necessary protection through vaccination, it can be more serious to your health the second time around. So as soon as you are deemed recovered, you don't have to wait. You can go and get your second shot.
Thank you very much.
Okay, thank you, caller. We go back to the lines. Caller, you're live.
Good evening, Mr. Liburd.
Good evening, my lord.
Yeah, and good evening, Dr. Wilkinson.
Good evening.
A quickie. How does a doctor protect him or herself against this highly contagious virus, the Omicron, when, as part of your profession, you have to be up close and many times in contact with your patients? What do you do to protect yourself in situations like that, which must occur daily and quite often on a daily basis? A list of it, of course.
Yeah, well, that's a very good question, and we need only to look back 18 months and realize that when this pandemic started on the other side of the Atlantic, the majority of the persons who were dying from a profession really were doctors and nurses, because it's impossible for us to social distance. Thankfully, we have vaccines that offer significant protection, and we have the non-pharmaceuticals. And so as a physician, you cannot social distance, but we need to be very vigilant with our mask wearing, with our hand sanitizing, and making sure that we get the best protection, which is the vaccination. We have had one or two doctors who have come down with COVID-19. Thank God, 100% of our doctors in the hospital have been vaccinated, and so those who have gotten infected, their symptoms have been mild and they have recovered quickly. It might only be a matter of time before it reaches all of us, but because of the commitment we have in terms of to our patients, we cannot social distance, and it's a risk that comes with the job.
Thank you very much. We go straight back to the lines. At 9:14, caller, your line. Okay, now, in terms of, we probably don't have that call at the moment, but in terms of going forward, though, Cameron, you mentioned the folks in the hospital who are indemnified through their vaccines. What about the schools? I understand have for the openings. What about those in these essential services? How is that vaccination rate coming, and what can be done if it's not at the level it ought to be?
Well, there is still a significant percentage across the board of our essential workers who are not vaccinated. When I say significant, in some groups 10, 15, 20, 30%, and that is significant. But we continue to push the voluntary acceptance of the vaccination. I personally believe that if you are offering an essential service, it means that it's a service that is needed, and those needy persons should not be exposed to the virus by you because of a choice that you made. And so I believe that every essential worker should be vaccinated. I believe that every doctor, every nurse, every police officer, every teacher, anyone who is in contact with the general public on a regular basis like that they should be vaccinated. There is no mandate in the Federation of St. Kitts and Nevis, and so we appeal to persons' sense and sensibility. And I believe that if we have essential workers who believe in science, who believe in the fact, who believe in the truth, that they would eventually come forward and get vaccinated. But time is of an essence. Yes, our figures are trickling upwards, and I still have confidence in our people that they would do the right thing.
Would you say though that in terms of those who I refer to as second doses, I think that number has lurked in the high 70s for some time. Would you say that's going as anticipated?
Yes, I believe the persons who came for their first shot, they are coming back for their second shot. All throughout the discrepancy between the first and second shot has been about 5%. So, for example, if you look at the Federation's figures, they said we have, as of yesterday, 81.7% with one shot and 76.1% fully vaccinated, and so that's a difference of about 5-6%, and that's what we've been seeing all along. And so, for all intents and purposes, everyone who came forward for their first shot, they have been coming forward for their second shot. We have not had any significant discrepancy, and so that discrepancy simply reflects the time lag between the first and the second shot. Yes,
Let's
there
go
might
back to
be
the lines. Call your line.
Good evening, sir.
Good evening, sir.
Mr. Robert, good night. I want to talk to Dr. Wilkerson. I want to say
Yes,
you're doing a good work. You and your team, along with Dr. Laws, and I want to congratulate.
Is the sound gone? I can't hear anything.
You seem to have lost that caller. Seem to have lost that caller. If you wish to come back and caller. And as you were saying, Cameron, in terms of the discrepancy, that's the word you use, and I don't know if it is my own weakness, because mathematics is my strongest weak point. And when you look at the roll up and roll out figures, you see total vaccinated 25,000, but that's children. Let's go to the total doses administered is 56,180, and doses administered instant kits is 42,768. Those are first and second doses.
Hold on a second, let me pull that tile up. So you said when you look at the vaccination tile, we see the total doses administered, what you said, that is 56,180. That includes first and second dose and boosters, yes?
Okay, so the 42,768 first and second doses as well.
Yeah, first, second doses, boosters include adults and children.
Okay, that makes more sense to me. Let's go back to the lines. I'll call you live.
Yes, Mr. Robert, it's me again. You
Yes,
were
sir.
saying something.
Back. You finished your point?
Yes, I had finished. I said I will listen up here.
Okay, well, I'm sorry about that. We missed you. I thought you were not finished.
Okay. All right.
Thanks
No
for
problem. You're welcome.
clarifying that. Yes. So let's go back to the lines. Call you live. Okay, we seem to have missed that call. It's
While we're waiting
now
for
20
a
minutes
call,
past the 9 o'clock hour. We have in studio with us Dr. Cameron Wilkinson, who is the medical chief of staff. We're looking at COVID-19, where we came from, where we are as we speak, and in terms of living with COVID. And the other thing too, as well, I don't know if it's a good or a bad thing, or if the figures were even examined before in terms of the percentage who have come down with the COVID who are unvaccinated versus vaccinated, or we have now put that aside because everybody is exposed.
No, well, I'm glad you brought it up, because I just wanted to speak some more about that also, in that we know that we have a high threshold of population immunity among our adults in the Federation of St. Kitts and Nevis. Say, for example, in St. Kitts we said we have over 80 6% of adults with one shot. It means then that if lightning was to strike, it most likely will hit somebody who is vaccinated, because by the sheer proportion of persons now, greater proportion of persons who are vaccinated, Omicron is highly transmissible, and so it will infect the vaccinated and the unvaccinated. It will infect everyone, if it can, in the entire population of St. Kitts and Nevis. However, if you're vaccinated, you will have less severe disease, you might be asymptomatic, and your recovery will be much faster. So when we look at the breakdown of persons who are coming down with Omicron, 80% of the persons thus far have been vaccinated, and 19.8%, which is a smaller population of persons now, are unvaccinated. However, the ones who are fully vaccinated, their disease are mild, and their risk of hospitalization is significantly reduced. And so although Omicron is a milder disease, it can still be severe for someone who is unvaccinated. I also want to speak about the age groups, because the vast majority of persons who have been infected in this wave are the young and young adults. For example, between the ages of 19 to 29, we had 24%. Between the ages of 30 and 39, we had 28%. So with those two groups, between 19 and 40, we have a total of 52.1% of those persons who were infected. Now, these are the same young, strong adults who want to go out and party, they want to be on the strip, they want to play contact sports, etc. But when we look at the vaccination coverage among this group, it is also pretty low, because the majority of the persons who are contributing to the 80+% vaccination coverage are the persons 40 and over. And prior to this fourth wave, we were engaging a number of the sporting associations, cricket, basketball, football, who wanted to start contact sports. And contact sports itself is a risk. It could be a super spreader. And we were asking them to come forward and be vaccinated so that we can get at least a 70% population threshold coverage among the sporting community before they can safely restart these contact sports. And I do hope that they were using the opportunity to go forward and get vaccinated. People want to make it to the national level in terms of representing the country, but you also cannot travel to certain places without being vaccinated. And so there are a number of reasons, even if not just for your personal health, why you need to go and get vaccinated.
What do you say, Doug, in terms, well, you mentioned the vaccination coverage, but what about the use of our non-pharmaceutical tools, the masks in particular? You go out to these clubs and everybody is maskless or unmasked. I mean, can there or should be some improvement in that particular area?
I believe so, and I actually believe that masks should almost be as available now as toilet paper is in a toilet. And so I really believe it is time for even business places to start to make an investment to make masks available, so that if you are going into a big business establishment and you do not have a mask, they could offer you one. Okay, even if it's a mask that is advertising their product. But we need to make sure that these masks are available and that the price comes down through subsidies, etc. If it's an essential part in the fight. There are a lot of persons who I see sometimes with a mask, a paper mask, but it is of no good anymore. It is dirty, it is torn, it has been used several times. There are some persons who tell me that they wash their cloth mask and dry it and use it again. And so you could have somebody with a mask on their face that's not providing any filtration at all. And so I believe that we all have to play a part. It's okay to say wear a mask, but we also need to make it more accessible, because it's not just wearing a mask, you need to wear an appropriate mask appropriately. And people also need to stop seeing a mask as just a pass to get into certain places. I'm sure you've seen this, where if you need a pass to get into a club, a mask to get into a club, they put on the mask to get inside. But once they're inside, they take it off. I also want to speak to the authorities, because we have to also exercise some discretion in that you can also see persons at a bar having a drink without a mask, but it doesn't necessarily mean that they are being irresponsible, because you could be moving in your own circle. These same persons who might have been from your household, and now you are at a bar having a drink. It's difficult for you to be at a bar having a drink with a mask on. And so you have to exercise some discretion when you're looking around. And so I don't just look at someone standing there without a mask and judge them. You have to assess the situation and see what's happening, because it's not practical to wear a mask all the time. The same way it's not practical for you to social distance all the time. And we have to understand that it's the combination of all of these things that will help us. Being vaccinated, social distancing as much as possible, wearing the mask as much as possible when you are in public, and hand sanitizing. You may not be able to do all four at the same time, but you need to make sure you try to do them as often as possible.
I take your point. You promoted the spirit of the regulations, but I can confess, I went to a club and I visited kids, all done with my mask, but once you entered, everybody was without a mask, and I felt like a puppy show. So it was reverse psychology, and I donned my mask. Is that what's happening?
Well, I can tell you, sometimes I go to the gym and I'm the only one in there with a mask, and sometimes I feel like an old man also. I wonder, these people know something I don't know, but I continue to do it, because sometimes there is just that one person who will follow you, and that one person can make a significant difference when they follow your footsteps. And so when you are a leader, you don't follow the masses follow you.
I got your point. Well said, Cameron. Now, as we move forward, it's we understand that we have to live with this COVID. And you seem to suggest, or perhaps insinuated slightly, if I interpreted your proposition earlier, that there may be some more deaths in some cases. We haven't had a death for a long time though. Is it because this variant is not as, although it's highly transmissible to use the word, it's not as deadly as the others that came before, or have we been just fortunate?
Well, it's a combination of things. Yes, Omicron is not as deadly as the other variants. Both the scientific studies in hamsters that were infected with Omicron compared to hamsters that were infected with other variants, the Delta, etc., it shows that Omicron mainly affects the upper airways, the trachea and the throat area, but it does not significantly affect the lung tissue. And all across the globe where Omicron has been spreading, we have not been seeing the severe infections requiring persons to go on ventilators that we saw with the original strain or with the Delta variant. And so this is good news. However, by the sheer volume of persons who can get infected, the healthcare system can be overwhelmed, and persons can end up being sick and persons can die. We must understand that we also have some elderly persons in our community who are pretty fragile, and just having a little fever and a cough and cold can lead to something else. And so that is why we need to protect these persons. I believe, though, that we are seeing the significant recoveries because of our high vaccination threshold. I told you early on that I was very happy when I saw that today we had 130 recoveries compared to 85 positive cases. And in my presentation on Wednesday, near briefing, I showed a graph where it showed the wave with the positive cases, and we showed the recoveries that were coming up behind that graph. And I said I wanted to see these two graphs meet. Little did I know that a day later we'd have seen the recoveries cross the positive cases. This is a good sign. I don't think that we have reached the peak as yet, but there is light at the end of the tunnel, and I believe that although Omicron can affect some persons severely, we should do well, and I'm hoping that we don't have any deaths, and the control is in our hands. If people continue to go out and get vaccinated, if people continue to do the basic things that are required, to wear a mask as much as possible, to hand sanitize, to avoid crowds. I am a carnival person, you know that, Ian, but I made a conscious decision to stay away from certain events. I went to the Calypso show, I went to a couple of the tents, but apart from that, I kept a very low profile. And just because, as your mother used to say, it's not every pan knock you have to be there.
So Cameron Wilkerson missed the bubble juve?
I don't think I'm going to miss it this year, though. 2022. I believe this is the first time in my 25 years back home that I missed a juve. But I spent it with my grandchildren. I was very happy. I enjoyed that.
And everybody saw those muscles on Facebook.
I was showing my grandchild.
Cameron,
yes.
The airlines are back. The cruise ships are back. And I reflected, and lots of people don't really know this. I remember it was before COVID was declared a pandemic in March. We had a cruise ship with some Italians on board, and experts, including yourself, the CMO and another doctor, came to cabinet and advised us that we should not grant fatigue to that particular vessel. I don't know if you recall that.
Of course,
it
I
just
recall
came
that.
to mind.
I recall that quite well.
It was a tough decision for the cabinet to make, and I know from that time, cabinet has always listened to the advice coming from the experts like yourself. And you see what has happened. But now the airlines are back, the cruise ships are back. We've had 6 and 5 cruise ships in recent days. Is there anything for anyone to be concerned about, in particular, with these cruise ship arrivals?
Well, once we are on the face of the earth, we have things to be concerned about. I always say, though, that as we move forward, we have to balance risk and reward. And we could have kept the country locked down and not have any spike. For example, going into December, when we only had 6 cases, we could have gone and advised the Prime Minister, and if he followed us, close the borders, turn the cruise ships back, cancel Carnival, and today in January we would not have had any cases because the few cases we had would have petered out. But that was neither advisable nor recommendable. We need to move forward. We need to learn to live with COVID-19. We have attained a significant threshold of population immunity, and so we need to invite the cruise ships back because our economy depends on that. Now, with that said, we examine the information coming from the cruise ships, and we grant fatigue to cruise ships that have a low threshold of positive cases. And so with the passengers having to be vaccinated before they get on the cruise ship and having to have a negative test, the risk associated with having the cruise ships come here is significantly reduced. Nothing is without risk. And I'm pretty certain that sometimes you would have seen a schedule that came out that would have said that we will have 6 ships and then only 4 come, because we would have examined the information that they sent to us, and if we thought that a ship would be risky based on the number of positive cases on board, we would not grant fatigue. And so we continue to do everything in our power to keep the countries safe and yet generate economic activity, because one can survive the virus but die from the economic hardships imposed to control the virus. And so it's a balancing act, but I believe as a country we have been doing well so far. And so my office is just across from Bozanta, and when I look out and I see 3, 4, 5, 6 ships, I feel happy. And I also think about you, because I know you had a part to play in providing a space for those cruise ships to dock.
No, thank you. Are you saying then, and for sake of clarification, first of all, each ship arriving at port, or before they arrive at port, they must have, or their passengers and crew must be vaccinated, one, and they must have a current a COVID test?
Yes.
Negative COVID test?
Yes, they must have a COVID test, and they also must have less than 1% of the population on the cruise ship negative for COVID.
So that is declared by every captain, every master?
Yes, it's declared, and the information is examined by the CMO's office, and a decision is made, of course completely independent of government, whether or not to grant fatigue.
Okay, that's good news, because there's a speculation that the cruise ships won't pushing passengers, in fact, won't are vaccinated. But you're saying the threshold is 1% of the passengers on board?
Yes.
Or souls on board?
Yes, 1%.
Okay. Now, Cameron, we have spoken, we have touched the issues as it relates to the science. Are there anything at this moment that I would have omitted? Anything you want to interject at this point?
Without sounding like a stop record, I just want to, at this point again, to ask everyone to get on board. I appreciate what you have been doing in the fight against COVID-19. I listen to your shows on a regular basis, and I see that you have been speaking about this virus for near 2 years now. And I do believe that there are persons who would have gone forward and done the right thing because they have been listening to you. I keep saying that we in the Ministry of Health, we do not have a monopoly on information. We don't have a monopoly on advice. And the advice going forward can come from anyone. I've spoken before of a situation where I had a friend who I kept trying to encourage him to go and get vaccinated, using every trick in the book that I know to convince him to go and get vaccinated, but I just couldn't get through to him at all. And then one day he called me and said that he went and he got vaccinated, and I said, oh, I finally got through to you. He said, no man, I saw the mansion bull went and got vaccinated, and if he could get vaccinated, I can do it also. And so the point I'm making is everyone who has a mic really should be doing the right thing and encourage persons to get vaccinated. And I find it disingenuous when I hear certain persons before a mic telling people otherwise. You have been in politics Ian, and I'm pretty certain that when you were canvassing, you never went and tell persons, well, I believe that you have the right to exercise your right to vote, and there are X amount of candidates on the ballot, and you have a choice. You don't tell them that. You tell them, vote for me. And I believe it's the same way we need to approach this virus. If you know that the vaccine is safe and effective, and you are in a leadership position, you need to send a clear and unambiguous message to the persons who are listening to you, to the persons who are following you, and let them know that they need to protect themselves, especially if you have already gone and protected yourself, especially if you already had every single family member and dear friend who you know gotten them to go forward to get vaccinated. I don't know if you agree with me there. You can let me know what you think about that.
Well, I have spoken quite clearly about that, and I've laid culpability to at the feet of some doctors. As a matter of fact, that's the extent to where I went. I mean, when you have doctors, doctors, I think, have an oath, have a right, have a responsibility to protect the health of our people. And when you have doctors themselves vaccinated and still promoting vaccine hesitancy, I call it, I think that's perhaps the hypocrisy you spoke about, but I never realized it was a pandemic there was a pandemic of hypocrisy, and there's something more that that I didn't know. Perhaps you are in that fraternity, so you would know that. But the lines are still open, my straight dog family. If you so wish to call, the numbers again are 465-2555 and 718-577-2916. It's 60 minutes before the 10 o'clock hour. As we wind down tonight's programming, we go straight back to the lines. At caller, you are live.
Hello, good evening.
Yes, good evening, sir.
Would you like to tell you that?
Good night.
Yeah.
Yes, caller, you're live.
Yes, I would like to get from you, sir.
You like to get what?
A Kaiso. You like a calypso for me?
Or you want him to write a case for you?
Yes.
No.
Anyway, tell him about one of the good customers.
When you want me to write it now?
No, hold it until further down.
Okay.
Are you still there, caller?
Yeah, I say have a good night.
Yes, you take care. It's
Right,
nice to
sir.
smile. You put a smile on my face.
How did your calypso do, Cameron?
Well,
Take it.
there's a calypso that goes, the better man will win and the lesser man will lose, and the king will be the one who the judges choose.
You didn't write that. But getting back to our discussion, and perhaps we can also look at the benefits, because where there are challenges, there are also opportunities as well. What opportunities that have arisen from these challenges that we have in terms of our health promotion, our improvement of our health systems? What can you point to
Yeah, well,
in that regard?
Well, from very early on in the pandemic, significant funds were injected into the health system, and so we received a number of ventilators, we received a number of oxygen saturation monitors, nebulizers, new x-ray machines, and so we have actually benefited significantly from this pandemic. We also know that we had 2 field hospitals that were delivered, one for St. Kitts and one for Nevis, and these are hospitals that could be deployed anywhere there is an emergency. We have not set up the field hospital as yet, but there are plans to have it temporarily set up at the Joseph and France Hospital. But if there's an emergency in Sandy Point, Newtown, etc., be it a tidal wave, an earthquake, etc., we can deploy these field hospitals and have the care delivered right on the spot there. So we have benefited significantly. I also believe too that we have developed closer relationships with our Caribbean partners and the United States also, and these are all beneficial things that have come out from the pandemic. As from the people's perspective, I have seen a number of businesses that have started to thrive because of the pandemic. There's some persons who benefited from making masks. I know that there was a lady who I knew who made school uniforms, and when the schools were closed, I asked her how she was doing. She said, "Doc, I'm doing quite well because I am making a lot of masks now." And so people have had ingenious ways of getting along. There is a gentleman who I remember earlier on in the pandemic, I told my children about him because he used to have this monkey, you know, where he would be having the tourists take pictures with him. And I saw him in the parking lot. He was asking to wash my car. So I said, "But I thought that you usually work taking pictures with the monkey." He said, "No, Doc, these are hard times. I ate the monkey, and now I'm going to be washing cars until the tourist season starts again." And he's back down on Port Zante now with a new monkey. And so people have to be innovative.
We call them primate vendors.
Okay. Primate vendors.
Yes.
Well,
it's a nice word.
I actually have quite a few of those primates who, I mean, they terrorize my home every morning and every evening. I'm going to invite some of those vendors over to see if they can collect 1 or 2 of them.
Collect them.
Yes, yes.
Yeah. You must have fruits in your yard.
Yeah, but you know, those primates are very smart though, you know, because a friend of mine gave me a catapult, and every time I come out with the catapult, they all disappear. Even before I could even fire one. But if I come out without it, they don't run.
So you understand now, when the pelt stones at the messenger and ignore the message, it's because the messenger is doing a good job. Lest they won't pelt any stone.
Oh yes, oh yes.
But you are strong. Your back is broad, as you said earlier, and sure. So as we wind down tonight, though, Cameron, I think we have all agreed that we will have to exist, or we will not totally eradicate this COVID-19, but we have to control it. When would you feel comfortable as the one, along with Dr. Laws, the 2 champions, and someone referred to you as a star? In fact, you've got the Star of Merit already for national service in this crisis. But when would you feel comfortable to say, well, we have overcome this crisis and we can now relax? How far
Well,
are we from that particular juncture?
Well, the situation is mercurial, but I am waiting to see what happens as we get through this wave with Omicron here in St. Kitts and across the globe, because the Omicron could be a blessing in disguise, and I say that it is highly infectious, and so very quickly it is becoming the dominant strain, yet it is causing less severe disease. It's going to be almost difficult to find a virus that will become more dominant unless it is more infectious than Omicron, which is difficult to envisage. And so I believe this wave, this fourth wave of Omicron, might be the one that turns this pandemic into an endemic situation where we have a virus that causes mild disease, and if people continue to get vaccinated, etc., we would have passed the worst in this pandemic. And so I am hopeful that as we move into the latter part of the year, we would start to see some sense of normalcy. That is my vision and prediction.
What would you say, though, to some of those people who may have some symptoms and who, in their own judgment, personal judgment, instead of doing a test, they accept or claim that they just have the flu and don't even stay, as we say colloquially, don't stay yard or even go to work, and perhaps maybe very well have that Omicron.
Well, I think that if someone has a flu-like illness, even if they don't get tested, they should try to isolate. They should wear a mask. Even before COVID, when someone had the flu, they would stay home from work for a couple of days. Okay, and so if someone has a little scratchy throat, etc., and they feel that they are coming down with something, they should stay home and stay away, because that is the only how we're going to stop this virus from spreading. There are a number of countries that are moving away from testing someone who was positive with COVID to prove that they are negative before they are released. Some persons are advocating now that once you are symptom-free for X amount of days, you can be declared recovered and start moving on again. And as this virus or as the infections with Omicron prove to be milder, that is where we'll be moving. So it will be a situation where somebody gets infected, we know that they are protected through vaccination or probably from previous infection. They isolate for a few days and then they come back into the work field. So I see some light at the end of the tunnel, but it comes down to personal responsibility. You cannot be sick and be moving around.
And some people, in fact, do that.
Yes, some people do that. And before we wind up also, I also want to make an appeal to the organizers of mass events, because I know that the entertainers and organizers of mass events, they suffered a lot during this pandemic. But whenever there is a significant wave, we don't hear any calls to have mass events. And when the wave is over, we still need to maintain some vigilance. And mass events are going to come back, but until we have COVID-19 behind us, we need to still act responsible. And so if you are having your event, please don't overbook the place. Please ensure that people wear their mask as much as possible. Please ensure that you have your hand sanitizing stations, because it is better for you to make X amount of dollars with the place half full than to make $0 with the events closed down completely if we are going through a wave. And so do your maths. We will eventually get back to a time when we can gather together in large numbers without mask, etc. But until that time, just act responsible and do the right thing so we all can get through this safely.
Well, Cameron, you spoke to where we came from, and it gave us a clear picture of where we are today. You looked at what attributed to our success, looked at the challenges in the fight against this vaccine, looked at the vaccination coverage, and of course the fourth wave. And I believe we have covered the most salient points as we continue this fight against this COVID-19 pandemic. I never for one moment thought we would be discussing this today, 2 years after. But I really must commend people like yourselves, Dr. Laws, Abdias, the NAO Task Force, the HEOC, and all the law enforcement, all the frontline people. But as you wind down, I give an opportunity for your parting shots.
Well, you know, we said quite a lot tonight. I just want to end by saying what a pleasure it has been for me to be working with Dr. Hazel Laws as the Chief Medical Officer. It's a pleasure working with her. She's a great leader. She listens to all of the views expressed by persons, and she extracts the best from everyone, and that is a sign of a true leader. And I'm even more proud of her knowing that she was my junior when I was in medical school, and she reminded me the other day that when I left Jamaica for Barbados, I gave her my textbooks. And that shows that you can sow little seeds early on and see how they flourish later on. I know that she's listening. I just want to congratulate her for leading this country through the most tumultuous time. We got through the first 2 years safely. As I said, we are seeing the light of the end of the tunnel, and I want to continue to ask her to stay focused and give her my full support as we move forward doing what is best for the country.
And I too want to associate myself with those comments, words of commendation, and to also applaud you for your humility, and having sowed the seed, you must be feeling proud. But thank you, Cameron. We have been having a discussion with Dr. Cameron Wilkinson, the Chief Surgeon and Medical Chief of Staff, who was here tonight to outline the current disposition, and I know that you told me that the CMO is resting, and you in fact just took the opportunity to take the mantle on Straight Talk tonight, and I thank you for that. And as I said to you, Straight Talk is always a medium available to you, Dr. Laws, and your entire team. But I want to thank you for spending the time with us tonight. And my Straight Talk family, my time is done, so I have got to run. I want to thank Almighty God for guiding our conversation tonight. And as always, I want to thank you, the callers. I want to thank you. I overlooked my emails, and forgive me for that. And I want to thank all of you who listen on social media and on the big bad ZIZ Radio. Remember, you are the ones who make Straight Talk. I must thank our technicians, Theo, the mayor of St. Paul's, Clark, and in the back room, David Wilkerson, and John James, who all make Straight Talk possible. And without you, there's no Straight Talk. But have yourselves a wonderful weekend, and be good to all whom you meet. And remember, whatever your mind conceive, that you will achieve. But you first of all got to believe. So when you wake in the morning, thank God for the morning light. Thank you for taking you tonight. And my Straight Talk family, keep moving on. Thank you again, my brother, my friend, Cameron Wilkinson. Bye.
In the morning, I thank God for the morning light. Give him thanks and praises for taking me safely